Thank you, Alice, for your perspective on what's happening regarding abortion care in the UK. And I think that's really progressive. And one promising thing in terms of care and funding, that in terms of like access, in terms of countries that may not have funding or provide access to abortion. Biden's government just, I think, announced today that they are restoring funding that Trump previously banned, that allows foreign aid from the U.S. to provide abortion care in other countries. But as well, I wanted also to draw attention to the presentation that Dr. Pillay provided in terms of looking at how, in the research, how youth and adolescents, drawing attention to how they should be involved in creating policies and strategies that are helpful to their sexual and reproductive health. And I was just wondering and thinking, youth-centered design or youth-centered approaches is something like fairly new that organizations have started to kind of take into account, involving youth in designing solutions for their own reproductive health. So how do you see, in terms of the pandemic, we had just started getting into involving youth? How far back has that put us? Because now with people being isolated, communities being isolated, and all the work that was being done came to a standstill. So now with all the unintended consequences, the unintended pregnancies, how far back do you see the pandemic has put, especially the global south, in terms of sexual and reproductive health, especially for girls?
As you've seen, Biden said, and you said it, the global gag rule has been repealed, but also the Geneva Convention, and I guess that's the name, which is all about anti-abortion, that the US, Brazil, and Egypt and other countries signed for. Biden is trying to take the US out of it, or has taken the US out of it. So I think this is a new era for SRHR, not just in Africa, but also in North America, as in Europe as well, and Asia, because you've seen that some of the restrictive policies have been on the opposite side of what we would expect. People would think is in Africa, but some of the most restrictive policies against SRHR has been from elsewhere.
On the increasing access to abortion service, like Charity said, is really progressive, really forward thinking. But then I worry about how we have continued and really encourage the use of telehealth, which is great. It's super. I like it. But I think we're continuing to lock out a population of people that's not able to access it. So we're increasing into the social determinants sphere, because then we're continuing to lock out folks who would not be able to access the internet, or would not be able to access services through the internet or digitally connected.
It could definitely help to actually explore how countries are or became resilient in actually entering back to the threat that the pandemic represent, but also looking at health system resilience, but also individual, interpersonal, community and societal level of resilience during the pandemic. And then the whole issue about telehealth in the 50 states as it could help women, it's definitely something to have on the look.